Aged care, it's changing for the better. The Code of Conduct for Aged Care, also known as the Code, applies from 1 December 2022. It aims to improve the safety, health, well-being and quality of life of older Australians receiving aged care, regardless of who provides that care. It does this by empowering consumers, promoting respect, and building trust in the care they receive. The Code will help you better understand what is expected when delivering care, support and services to consumers. The Code applies equally to approved providers of residential, home care and flexible care services, their governing persons, for example CEOs and board members, and their aged care workers who provide care or other services to consumers. This includes people employed by the provider, those who are employed by a contractor or subcontractor of the provider, as well as volunteers. The Code does not apply to visiting medical practitioners, pharmacists, and other allied health professionals requested by or on behalf of a consumer but are not contracted by the provider. Tradespeople who perform work that is not under the control of the provider, for example, those visiting for a one-off maintenance task. Commonwealth Home Support Program providers and National Aboriginal and Torres Strait Islander Flexible Aged Care Program providers. However, these providers are still required to provide safe and respectful care and behave in a way that aligns with the Code. The requirements of the Code should already be familiar to you, as they are consistent with your existing responsibilities. Providers, governing persons, and workers must act in a way that is respectful, kind, and consistent with the behaviour set out in the Code. Providers have the additional responsibility to take reasonable steps to make sure their workers and governing persons comply with the Code. The Code includes 8 elements which require you to respect people's right to express themselves and make decisions. Treat people with dignity and respect and value their diversity. Respect people's privacy. Provide high-quality care in a safe and competent manner. Act with integrity, honesty and transparency. Take action on quality and safety by promptly responding to issues and concerns. Provide safe care free from all forms of violence and abuse. Take reasonable steps to prevent and respond to all forms of violence, abuse and neglect, including sexual misconduct. If you act in a way that is not consistent with the Code, the Aged Care Quality and Safety Commission can take action. This might include issuing caution letters. In the most severe circumstances, you may be banned from providing aged care services in the future. The Commission can also issue compliance and enforcement notices to providers. Any action that we take will afford you appropriate procedural fairness to have your say. To learn more about the Code, your obligations, and other aged care reforms, visit the Commission's website.